were just talking about it there before the news. In this day and age, when body image is more important than ever, cosmetic procedures are becoming more and more popular.
But for many, the thought of going under the knife to lose the flat is just too much. So here to tell us about some alternatives to surgery is cosmetic consultant Dr. Patrick J. Treacy. Patrick, good morning to you. Thank you for coming on the show. Now, this has caused much excitement and interest this morning because liposuction, for many, a lot of people would want to get it done, but they'd be afraid of going under the knife. So these are cosmetic procedures that will give you the same results or even better results than liposuction.
Probably it's unfair to say they give you better results. Everybody has a certain amount of fat, and at different levels of both the amount of fat, some of these procedures can be done. There is one of them an alternative to liposuction, but if we just take...
we'll start with the Ultrashape.
Which is handy because I have this here. This technology started its life, believe it or not, in the Second World War. Whenever they started having sort of jet fighters that travelled faster than the speed of sound, they noticed that the windows in them broke. It moved in Munich into renal stones. This is the sort of same technology was used to blast away kidney stones, and now the Israelis have used it to blast away fat.
So it uses ultrasound waves to break up the fat?
Absolutely. So there's no surgery involved, there's no downtime involved. The patient can come in for half an hour, sit and watch a video, and normally it requires 3 treatments, costs €1,700 for 3 treatments, and on each treatment the patient will lose an average of 2.5 centimetres.
Okay.
This
and does it hurt, or you wouldn't feel anything?
Absolutely. No sort of pain at all. You may feel a slight heat. Patients describe it as a very comfortable feeling, and certainly this is the easiest way to lose fat.
Any side effects?
No side effects that we have noticed at all. The fat is broken down into triglycerides and free fatty acids, and they're safe for the first 3 or 4 days so that you don't reabsorb those to sort of stop taking fat in your diet. We can put in some fat blockers like Xenical, and that means that sort of the fat that's broken down at least is metabolized and taken away.
So who is this suitable for? Who at home is thinking? Probably
patients like Alan earlier, that sort of, you don't see too much fat on them, but still at the same time they see it themselves, so they can grab it. Probably, yes.
Okay.
People that certainly are maybe carrying a half a stone to 3/4 of a stone over, I mean, this is perfect for them.
Okay.
Carrying
1,700 for 3 treatments, and that normally should shift pretty much whatever you want to shift.
Absolutely. You lose a breast size.
Is that for good then? You don't have to go back? If you look after yourself.
I think, to be honest, none of these are for good, including liposuction. There's a mythology out there that once you take away the fat cells, and it's often sold like this, that they never come back again.
I thought that was the case, yeah.
Yeah, unfortunately what happens is the fat cells that remain can get bigger, so a lot of people who get liposuction, if they don't watch themselves, within 3 or 4 years they may need a second treatment.
Okay.
It comes back, and it comes back in a kind of a bulgy fashion as well, doesn't it?
The interesting thing, Mark, the way it comes back is this. It comes back 4 times faster than normal fat, but if you exercise it goes away twice as fast as normal fat. So it's actually quite easy to keep control.
Yeah, you see, the thing is that it's not just having the procedures done, Patrick. You need to change the lifestyle as well to make sure that it stays off. And people kind of think this is a miracle cure and I can go back to eating all the crap that I was eating before. You can't do that.
Absolutely.